My name is Leo Ho. I'm a pediatrician, and I was working in Bo, Sierra Leone from February to August of 2007. Well, I was mainly the doctor working in the ICU. Most of the time I was in the ICU taking care of the most critically ill patients, most of which were young children under 5, and most were under the age of 3 also. Those were the most susceptible patients, especially to severe malaria. So this is an interesting shot where there's 3 of us attending to these sick children, and I'm in the middle, of course, and to the right is a Belgian nurse. Her name was Susie. She's actually resuscitating a child who was so ill that he or she stopped breathing. So when that happens, you put this bag over their face with a mask, and you start pumping the bag to push air into the lungs. Quite frequently, little children would come in basically comas, unarousable, just incredibly sick. Most of the time it was malaria. And severe malaria at times can become so severe that it affects the brain, and eventually the children progress into a coma. A lot of the parents kind of wait a little while until they bring their children in. Often they would wait until the child became non-responsive to bring them in the first place. So it's just really unfortunate because sometimes, obviously, the later they came in, the less we could do. So we did have a lot of mortalities. But, many of our patients got better also. So even if they came in a coma, often they would make a complete recovery. So we take a few drops of blood, and it's placed in this little plastic testing device, which is a rapid test for malaria, which tests for basically the most severe species of malaria, which is the one that was really prevalent there. And then within 15 minutes, you get a test result, whether it's severe malaria infection or not. Mainly, we were using the newer malarial treatment strategy, which is the artemisinin-based derivative. And it's really been just a great weapon because it's extremely effective, very well tolerated, and it's easy to administer. If a child was not that sick, which we call non-complicated malaria, often by the next day they're starting to feel better. And the treatment is usually just 3 days worth of treatment. Even in children in a coma, by 24 to 48 hours, many of them were starting to move a little bit. We would have at least 2 children die at our hospital every day on average, sometimes even more on a crazy day. And it would just happen so unexpectedly, and it's just such a sad situation when a child dies. A lot of these families came from small villages, and they didn't have a large support network and obviously couldn't afford many things. And so the majority of the children, after they died, we would actually give the caretakers cardboard boxes. The mentality is a little bit different because almost everyone you meet had a family member who died or knew someone who lost a child from severe malaria. But make no mistake that when it happened, and when you saw the parents in the ICU or somewhere else in the hospital, it's still just a completely devastating situation. There's a lot of malnourished children where we were working. A lot of different reasons for malnourishment. Sometimes it was just the children not getting enough food, but often there was other reasons why the children looked as they did. One of the largest reasons was tuberculosis and occasionally HIV also. And for me, a lot of the reflection was after the mission. It just seemed like so many things were going on that you just had to stay strong and keep doing what you were doing. And now that when I see these pictures and I think about it, I just can't believe the stuff that I saw, and I can't believe the environment that I was working in because we're resuscitating children every day and just trying to keep them alive.